And action! Billy had a question about ankle sprains, and I wanted to talk about ankle sprains. I think I've done a video in the past about ankle stability, but I was able to diagnose this without even seeing, because there is an algorithm for the average ankle. And plus, if we have my other colleagues in the field or in different states who have already x-rayed, I'm assuming the person reading the x-ray and the person shooting the x-ray is qualified enough. But if there wasn't anything that was remotely wrong with the x-ray, then we'll hope and keep our fingers crossed that no bones are broken. Now, initial sets of x-rays sometimes won't show up stress fractures till about 2 or 3 weeks later, so we might have to repeat an x-ray, but at this point we'll assume no fracture. Now, if there is no fracture, there could still be a problem with tendon tears, ligament tears. So I'll go through the pathophysiology of what usually happens, and I just happen to have an illustration. So this is a right ankle if you're looking at the right ankle from the outside, and if you're looking at the toes to the heel straight in. So this is what happens is you got the bones that make up the structure of the foot. You got the bone on the outside called the fibula, and that's a fibula, a tiny bone on the outside if you're looking straight on. And then you have the bone underneath called the talus, and the talus sits underneath the fibula and the tibia, and it moves. It allows movement back and forth, like bringing your foot into dorsiflexion or plantar flexion, but it allows very little movement in and out, eversion and inversion. You don't want to be able to make it too far in and out because, again, you'll sprain. So there's limitations. There's a lot of limitations going out. There's not so much. You have flexibility going in, taking your foot and turning it in. So with the limitations, you have the reasons for limitations are that you have ligaments. You have ligaments that hold bone on bone. So the ligaments on the outside are pretty pliable. The ligaments on the inside are not so movable. So the ligaments on the outside, the one that always is a problem is this one here. It's the anterior talofibular ligament. It's the longest, but it also, because of it's so long and it's unsupported, it's also the one that always tears. You can get to see a tear on an MRI, but to do an MRI for an ankle sprain, number one, I don't think an insurance company would pay for it. Number two, I don't need an MRI to tell me what I'm going to do with conservative treatment for an ankle sprain anyway. So x-rays are important. MRIs only if you're about to get into surgery or you've had failed therapy. So there's ligaments that hold this fibula to the talus and the rest of the bones of the foot that they'll usually give it limitations to how much you can turn it in. But if you go past the point of the restriction and you continue to roll the ankle, especially as you're older or starting up with an exercise routine, or you hit a divot and you're not ready for it when you're running, or a root, then sometimes we'll have to tear the ligament. If you tear the ligament, usually it doesn't heal up properly and it stays torn. Kind of like an elastic band. When you cut it in the middle, the elastic ends go apart and that's it. And we don't really need them. The other things that also tear are these things. They're muscles that go across the joint. So if this muscle goes across the joint and it is contracted, it makes your foot go down. And there's also a muscle in the front that picks it up. So if you roll on the outside, or if you roll your ankle in and you stretch the ligaments and the muscles on the outside of the ankle, the muscles, if you go far enough, will also tear. First the ligaments will tear, then the muscles will tear. If the muscles tear, they have an opportunity to heal up. So that's why it's so important when you tear anything of a muscle is you immobilize as soon as possible. You immobilize, usually you just immobilize with either a boot, like one of these bulky things. You can wear this boot, you won't be able to move, you'll be able to still walk around. It's like a walking cast. You'll still be able to walk around, move your toes, get it off at night so you can breathe a little bit, and it'll heal you up. You'll still have pain, but that's one option. Another option is if you are playing, you're an athlete, then sometimes you can immobilize the ankle so it doesn't move in or out, but it moves up and down. Plantar flexion and dorsiflexion are allowed. This is an air cast. So usually if your heel is right here, you put this around the heel, you strap it up to each side of the ankle and or the shin. That's the outsides and insides of the shin. Then you strap it up around like this, and you keep it, depending on how much flexibility or how much immobility, you keep it somewhat tight. And the cushions here, this is cushioning, that's why it's called an air cast, allow for a little bit of comfort so you can really snug this up. And also, as you move and lift up and step, it actually changes and pushes fluid out of the ankle and into the shin or into the toes. You can have swelling there, you shouldn't have swelling in the ankle. If you have swelling in the ankle, it becomes immobile. If you have swelling in the shin or in the toes, you can deal with that. So that's what's beautiful about these things. And you can usually pump it up a little bit if you want more cushioning. So if you can't get that, then you always have ACE wraps. You can use ACE wraps for compression. That's the acronym Rest Ice Compression Elevation. It's important for injury, whether it's in the back country or on field. Rest Ice Compression Elevation causes no further damage. It limits you from causing any further damage, because when you sprain the ankle, unless you're in backcountry with some of my hikers or you're doing a trail run, you have to get back to your point of origination. You want to limit the amount of damage, so do no further harm. So you don't want to be walking on an ankle that's already inflamed. Another reason why, as far as the I part of rice, is icing. Now this is this is a cool pack. You keep this in ice, and you use it I use it for my boxers as far as getting the swelling out of their zygoma. You can always get an ice pack, Ziploc bag, a couple of ice cubes and or frozen peas. Great for putting ankle into ice. You can also do ice contrast bath if you have a whirlpool available if you're in an athletic trainer situation in high school. But if you can't get an ice pack, those blue refeasible things, they're okay. They feel cold, but they don't really penetrate that deeply. An ice pack always penetrates deep, and when you penetrate deep, as far as cryotherapy, and watch my video, DrRic tutorial cryotherapy, you decrease blood flow, and if you decrease blood flow, you'll decrease the amount of fluid that tries to extravase or cause edema. The edema is a normal body reaction to injury. It causes, that's your cast. Your ankle is trying to tell you don't move anymore, so it causes swelling. But the problem is, we like to speed up the healing process in Western medicine, so thus we like to keep control of the movement with an air cast. We like to try to push the fluid away with ankle, either air cast or the elastic, and then we try to get ice involved in a therapeutic kind of maneuver. So if we get flexibility, we might be able to strengthen the tendon faster so it heals up real quick. The more blood that flows specifically to the tendon without leaking into the tissue, the faster you'll get nutrient to help reverse inflammation. Now, if you just throw a whole bunch of blood in the area, you'll get it to the tendon, but you also have it leak all over, and you'll have just a swollen, painful joint. I learned an old technique from an athletic trainer. He took Dixie cups, filled them with water, and then peeled off the top layer. That way you had a little handle, and you can use ice massage until you just keep on peeling the handle until there's no more ice, and you have about 10 minutes of ice pack. You can do that. 10 minutes of ice therapy 3 times a day to 4 times a day is real important to keep swelling down. And anti-inflammatory is also important. I don't have a problem with using anti-inflammatories over the counter like Advil, Aleve, Motrin, Naprosyn. But you have to be careful because those things do cause irritation to the stomach. There are 3 that don't cause irritation, or are built not to cause irritation, and they're safe. Nambumetone, Etodolac, and meloxicam. Those 3 have less gastric irritation than the other ones you'll find over the counter, but they're prescription. So you have to have your doctor prescribe them. If you're older than 18 and you have an ulcer, you can also use them as well. So that helps. In addition to turmeric and pepper, I think turmeric and black pepper are really good. My favorite form of that, Gaia brand, Turmeric Supreme, was unfortunately just knocked down by Consumer Labs. But Doctor's Best, according to one of my patients, Bill, Doctor's Best has been approved. You can check it on Consumer Labs, and they come up with approved and disapproved or not approved supplements. But if you do get turmeric, it has to have black pepper in it. Some people try to get curcumin, the active ingredient in turmeric. I think the studies are better with turmeric, but you can do that as well. Magnesium always helps. MagBind is nice if you happen to have a little anxiety too. I think it's kind of weak if you ask me, but it helps as far as decreasing inflammation. I love Panaway. I think Panaway by Young Living got me through 2 marathons, and it does help with, because of its helichrysum and wintergreen, helps to decrease swelling. You can actually eat that too. In fact, I ran out about 13-mile mark with my last marathon, 2010, and I was licking the bag just trying to get some anti-inflammatory in me. Again, elevation, as far as the rest ice compression at elevation. Elevation is very important because if you elevate the ankle, keeping the hip lower than the ankle, you'll drain fluid. If you have it down from the hip, then you're going to have fluid accumulate. So wrapping, keeping it elevated as best as possible, even if you're sitting at your desk. Not running on it for at least 2 weeks, and then getting into physical therapy. I think a physical therapist can use modalities like ultrasound, electricity, even acupuncture to speed up the healing process. All these things are great. They just compress a time frame of healing, in addition to you being healthy. So if you're drinking alcohol, you're smoking, cut it, at least for the time period of healing up. I don't like using dairy products. If you can avoid them, I think it'd be important. And usually that speeds up the healing process. If you have something of a hitch or a plateau, it can't get any better, especially with physical therapy and everything I just mentioned, something has to be investigated. That's where a ped x-ray comes in handy, and or an MRI. Sometimes there's other things like synovitis that could be an issue, or a stress fracture that didn't show up on the first set of x-rays. So, Billy, good question. Hopefully this helps you heal up real quick.